A very good evening to everyone. This is your host Vance here, and yes, today is Wednesday. It means that Kopi with Vance starts at 9 p.m. and here I am. All right, as you all know, I'm your host tonight, and I'm actually very thrilled to be here with all of you today because Kopi with Vance is a podcast that covers a wide range of health, fitness, and business as well as technology. So today's topic is particularly important one. It's about approaching bariatric surgery. All right. As you all know, obesity is one of the main pandemic or the endemic, we can call it. It's always a big issue because we all love food. So obesity is on a growing concern worldwide. And bariatric surgery also has emerged as an effective treatment option for people struggling with obesity. So we are honored to have a very special guest today, and that is Dr. Kaushal. He's a specialist in a general surgery and a consultant at Raffles Surgery Center. He's going to come in a 30 seconds time. Yeah, it should be about 30 seconds. He's going to come and share his expertise on this topic. And Dr. Kaushal has a wealth of experience in this field of bariatric surgery and has helped countless patients achieve significant weight loss and improve their overall health. He will also provide us a lot of valuable insight on the benefits and the risks of bariatric surgery, all right, and the various types of procedures available and the importance of proper post-productive care. I'm confident that today our discussion will be very informative, insightful, and thought-provoking. So sit back, grab a cup of coffee. I mean, today we are not grabbing a cup of coffee because the weather is really hot. So probably we're just going to stay with water. I'm not sure, but Dr. Kaushal, is he already has his coffee in his hand or in his table? Let's invite Dr. Kaushal. Hello, doctor.
Hey, hi, hello, Vance. Thank you for having me on Kopi with Vance, and happy to share my thoughts and have a good conversation, but without hot coffee today.
Oh, okay. I was about to ask you that, but since you say that there's no coffee, okay. The weather has also been very crazy, isn't it? It's all
Absolutely.
sweating. Yes. Doc, at your background, before we even start on the topic, on your background, I see a deer, the two deers.
I don't know. They are giraffes. They are giraffes. Giraffes.
Okay. So it looks like
We
a
got
deer
it
from
from
here.
yeah. No, it's from Serengeti. Yeah, we got a gift from a friend. Yeah.
Nice background you have, Doc. Thank
Thank
you,
you.
Doctor. I mean, despite having a busy schedule, thanks for joining us at Kopi with Vance. And of course, today's topic is all about approaching bariatric surgery. But before we go on, Doc, I know I did a little bit of introduction of yourself, but if you can just tell a little bit more about yourself to the audiences before we jump into the topic.
Yeah, sure. So I am a trained surgeon, a general surgeon, and then I did my subspecialty training in gastric esophageal bariatric surgery. So I do that is where I'm comfortable with doing gastric cancers and bariatric surgery, anything to do with the stomach and the food pipe. And I did my fellowship from Australia about a few years ago, about 2013. And since then, I headed the team of upper GI in Tantoxing General Surgery Department, and now I am in Raffles Surgery Center, where I practice at the present. Sorry, Vance, I cannot hear you.
Yes, my mic was muted. Sorry. Thank you,
Ah,
doctor, and thank you for
yeah,
all the audiences who are joining us.
yeah,
Today's topic is going to be very interesting because we're going to cover obesity as well. I think obesity is one of the cause of a lot of other illnesses that we can talk about. But also for viewers, we are watching this right now. We are in Spotify and Apple Podcasts as well as LinkedIn and YouTube. So if you're seeing this, do share and like so that more people can join in this podcast. So, doctor, before we really dive into the topic, we know that obesity is the main cause. I mean, not the main cause, one of the causes that related to illnesses, right? Like atherosclerosis, diabetes, and a lot of other issues as well, even knee issues, right? Because of your too much of weight. It's because we love our food. So it's going to be very challenge. How can we manage this, doc? I mean, in terms of your many years of experiences in this.
yeah. So I would like to first start off sharing some myths about obesity, and which you rightly brought it up. And one of the myth is that is related to food, is related to food addiction. And if you want to any addiction, if you want to go from, then you go away from food. But to sort of put it in the same pool as addiction to, say, alcohol or smoking, is very difficult, because in those kind of substance addiction, the first thing we say is that get away from that thing. But we can't say that with food, because food we need to live. Yeah. So the myth being that is an addiction, maybe is an addiction to wrong food rather than addiction to food. And that is one of the myths I want to bust for sure. Yeah.
I mean, we all surrounded by all the beautiful food, especially one of my favorite, if I can share. It's called the Madhu Vade. It's an Indian donut.
My favorite too.
Um, yeah, so it's a bit of weakness, but even though it's about 170 to 190 calories, but if you take more, then your calories will be added in. So we will keep it that for the later. We're going to jump into the bariatric, doctor. I mean, we've been hearing this word bariatric, and what is this all about?
Yeah, so this term started many, many years ago, which primarily means weight loss surgery. But maybe I can say something about obesity and severe obesity, which many of my patients, I see them suffering. And it is not exactly a simplistic problem as we sometimes prejudice them with, in terms of that if you eat less, you will lose weight. But sometimes it is a more complex psychosocial, genetic, socio-cultural influences which are interacting. And sometimes I see this patient is like he's stuck in a spider's web, in between. And it is not easy and simplistic to say that, look, you stop eating food. You can't say that, but you reduce the eating of food and you will lose weight and you'll become better. So therein comes in the hope for bariatric surgery, where we are then offering this hope to patients who are stuck in these kind of webs, I would say, and they need professional help, and they need a holistic help to bring them out.
Okay, doctor, thank you for that. I mean, the introduction of the bariatric surgery. And now, along the same segment that we want to talk about is also what is the profile are we looking at? Are they above 100 or
Yeah,
150? Because there was an article I was reading about in abroad. They're saying that this guy can't literally move at all. So he can't move from bed to
yeah,
hospital. They have to carry him in a truck or something like that. That sounds crazy. So what is the weight that is actually, I mean, in you
yeah.
you have
So
seen, doctor. Oh, your career.
yeah, so is the absolute weights are very difficult to say like that, because 100 kg in a 6.5 feet man would be normal, versus 100 kgs in a 5 feet individual would be abnormal. So we more realistically follow international guidelines, which WHO guidelines, which go towards the BMI indexes, which then categorize, which is an index form from weight and height, and which then we use it to categorize class 1 obesity, class 2, and class 3. And normally your BMI should be about 25 to 27. That is the usually accepted one. And anything about 27.5 is considered overweight. And also, classically, I would just like to bring out over here that even though the BMI is an international index and mainly written by WHO, which they say that anything from 30 to 30 to 35 is grade 1 obesity, and 35 to 40 is grade 2, and 40 to 50 is grade 3 obesity. And but for Asians, there is acceptable revision of this index where we reduce 2.5 compared to the Caucasians. So for us, where it is 30 to 35, it becomes 27.5 to 32.5. And so for every grade obesity, it is reduced by 2.5. And you would want to know why. And the
Right.
reason is because Asians are predisposed to visceral fat compared to the Caucasians. So the BMI, a same BMI of a Asian person versus a Caucasian person, the visceral fat is a lot more. So we want to intervene at a lower BMI when it comes to an Asian patient versus a Caucasian patient.
Thank you, doctor. Thank you for that. And also, we're looking at this candidate. Is that somebody can just walk in and say, "Hey, you know what? I need a bariatric surgery because I am lazy to exercise." Uh, will that be a candidate, or do you have certain parameters to look at and say that no,
Thanks,
you
thanks.
are not? Yes, you are.
Yeah, that's a very good question. So I we do not offer surgery for every candidate who kicks through the door, and we do not want bariatric surgery to be a cop out. That means that is the easiest way to go to. No, we do not want that. We want the candidate to try all different types of varieties of interventions put together by a very specialist team which we have, and that then helps. That would include like a health coach like yourself. It would include also a nutritionist. It would also include a psychologist, because we
Right.
have seen, and also a physician who will look at all kind of genetic variants, who will look at other disorders which this patient might be having. Because mind you, obesity has got a genetic predisposition, and if you truly have, you need to be very careful offering surgery for these patients.
Right. Thank you, doctor. Thank you for that. And also, we are be looking at into the different types of bariatric surgery and how do they work. I mean, I know the system, right? You know, your digestive tract, you know, your enzymes, your microbiome, you know, a lot of stuffs are happening in our body. But how do you look at, and you know, I mean, that's why I say the doctors are amazing. You know, you look beyond that, right? And in medical field, the medical science has improved so much. And also bariatric surgery is not just for cosmetic. Oh, I want to lose 20 kg because I got a wedding
Yeah.
coming in. No, it's not about that. It's about a health issue that is existing at the moment, and we want to clear that off. So what are the types that we are looking at now?
Yeah. So before I go on to the types, Vance, if you don't mind, I would just like to say the preparation which goes in for a patient
Okay.
to actually
Yeah.
qualify, because that is important, I feel, and I feel like the listeners should know that
Sure.
they go through a holistic program, as I said, where they have diet control, where they have behavioral modifications done by a psychologist, and also a health coach who comes into action about exercise and dietary match of nutrients and expenditure of energy, because there has to be a more expenditure of energy than the nutrients intake, and
Right.
we need that before we go for surgery. And it is also a test for the patients that if they go through this well, then they are ready for surgery, because we, as I said, we do not want to offer this as a cop out. We
Right.
want them to change lifestyle. We want them to become more motivated mentally, and then these surgeries and these interventions help. So I would like to emphasize on those things because that is important. And about the what kinds of bariatric surgery? Well, there are many kinds, but what we do
Right.
commonly in Singapore and worldwide is one known as a sleeve gastrectomy, which many would have heard and many would have read, and other is known as a bypass. Uh, a sleeve gastrectomy, very simplistically spoken, is about removing about 75% of your stomach. Okay,
Yep.
I cut it out and I remove it, and is out of your body. And if I can give an example, your stomach after that looks like a Cavendish banana from Fair Price.
Okay. Okay.
Okay,
That curvature.
yeah,
Yeah.
that much is your stomach now. Okay, that's how your stomach looks after I remove the stomach rest of the stomach canal. So basically, it helps in restricting your amount, and it helps to reduce your weight by not taking much. Like you will take two spoonfuls of rice or anything, and you'll be full already.
Right.
But the problem is that then the nutrition comes in, because we don't want you to be nutritionally deficient when your volume decreases so drastically.
Right.
So we need a nutritionist working, and you need to eat nutritious food according to our advice.
Right.
Yeah. So that is sleeve gastrectomy. Yeah. Go ahead, Vance. You want to ask me something?
Doc, I think it's another also interesting how our body, brain, mind, body, everything is connected, right? So the moment, can I ask that, after you slice it off, I mean, of course, in a operation manner, does the brain also understand that, oh, I now need so much now comparison to before because of these enzymes and hormones are fluctuating? Will there be also be playing a correlative manner?
Yeah, absolutely right. So yes, they would, and that is the idea of preparing them before surgery to be get ready for this. So your body is now going to adjust to a new stomach and a new way of eating. Is not easy for the first few weeks. So apparently, we most of our patients will go on just a liquid diet for the first 2 weeks,
Right.
and then after that, for the next 2 weeks, they go on to this like puree diet, like a baby diet, just
Right.
soft food. And then after
Right.
4 weeks only, you go on to proper food like noodles, bread, meat, eggs, and so on and so forth. So you're right. So that's 1 month required for the body and your brain to get used to a
To
new stomach, and your hormones levels to sort of now get used to a new way of living in your body.
right, right. So there's only two types. One is the sleeve, another one is the
Yeah. So
operate.
the
I mean,
bypass.
operating.
Yeah. So the bypass. Maybe I can say that usually in our concept, when we do a lot of workup for the patients right before surgery, we find out that there are two type of eaters. One is a volume eaters, and the other are grazers, as we call them. So the volume eaters are very clear. That is a non-brainer. Exactly, they eat a lot at one meal, and that's a problem. And the grazers are these people who do not seem to be eating more, but they eat small bites, but very high, dense calorie bites throughout the day.
Right,
And for them, so for the volume eaters, the sleeve works very well, because you can't eat much anymore, so that helps. But they can
right,
cheat if they are just a grazer. Yeah.
right.
So
So, does it also play with the cravings? Say I
yeah.
love nasi lemak and biryani for lunch and dinner, and then breakfast is bihun. So, will there be a psychological change as well? Because it also because of your hunger pangs are not activated, your secretion, your digestion system is now different. Will there be the psychological part? Because I recall you say that dietitian, psychologist also will be a play a part. Health coach also plays a part. So this seems like a very holistic approach.
Yeah, so it does help, and the patients do get prepared, but it is after the surgery, what happens to you. And sometimes your cravings can get better of you.
Right,
And we have seen now and again that patients after surgery want to eat the same way as they used to eat before. And now what will happen is, and we warn them also, but nevertheless, it still happens, because cravings are cravings, that if they eat even more or fast, so speed and volume becomes your enemy. So they eat
right,
anything speedfully or anything in high volume, they will vomit.
right,
So if you don't listen, or then you are made, is like if you don't learn the lesson by talking, then you have to experience it, and
right.
then they sort of get to the baseline back again. So
Okay.
yeah, it's a bit of a learning process after the surgery, where the patient
Right.
is learning his own physiology
Mm.
again. And sometimes it takes time. Some people are more, some people are less, but we are with them throughout the journey. It's not that we just do the surgery and leave them alone.
Thank you, doctor. Thank you for that. Also, we are looking at the patient both physically and mentally, and you have said it well because it is an approach. It's not just that somebody want to lose weight and then they come to you. No, it's not about that. But it's all about medical history or other medical condition they have. And one of the option or rather the patient can choose, or if that as a doctor as a consultant you say no, you have to go through this because your blood pressure is in the stage 3, your heart rate, and this is your diastolic, and diastolic is 180 over 120. Well, there's some kind of an indication who should go immediately, because I
Yeah.
believe if they're carrying that extra weight, maybe say another 60 or 100 kg, and they can't exercise because of knee pressure, or maybe their heart rate wasn't a good candidate, is there something that they look for, doctor? I mean, you look for?
Yeah. So we even in the international diabetes guidelines, and even for Singapore diabetes guidelines, and even the MOH clinical practice guidelines from MOH, they all say that if you have a BMI above 37.5, unlikely that you will get this weight off
Right,
with or without diabetes or high blood pressure. So if you want to just go on a single simplistic reading of a BMI, anything more than 37.5, yes, you might lose 4 5 kgs with dietary restrictions and all that, but
right,
the minute you stop, it will come back. And
right,
so it's not just losing weight, it is also about keeping it off.
right,
So the other things about is that if your BMI is 32.5 and above, and you are having diabetes and high blood pressure, and you have taken medications and it's not helping, and you're on high doses of insulin, yes, you should think about bariatric surgery, because over the
right,
last decade there's enough data to show that if chosen rightly and done in the right patient, this weight loss surgeries can provide cure for diabetes.
right.
For how long, how far, is depending on the patient, depending on the patient profile, and how much of a good boy or or a naughty boy he becomes after surgery. Yeah.
Okay. But the cravings comes back, doc. The same nasi
Yeah.
lemak, the same biryani, the same bihun, taking 4,000, not 4,000, taking 6,000 calories a day. Well, that will be a reduction in this.
Yes, there will be, because your hormonal changes happen and the signals sent to the brain are different now. And there's something called as a GLP-1 hormone, which increases in these surgery, and that sort of gives a negative feedback to the brain saying that my stomach is full, I don't need any food. So
Right,
yes, the reason why you can keep your weight off in the long term with these surgeries is that these hormonal changes are happening inside you, along with structural changes to your stomach.
Doctor, I'm going to share something with you. I mean, I'm in the fitness industry for more than 25 years. So
Yes.
time to time, I try different kind of diet to see how it works. If it works for me, probably it may work for my clients. So one of the things that I want to test my body is to go a cold turkey in sugarless, no sugar for a period of 14 days. And on the sixth day, I failed the exam that I put for myself. I was driving by. I turned into this particular petrol station. I parked the car. I went inside the supermarket. I opened up the fridge, and I was looking for a particular can. I'm not looking for a bottle. I'm looking for a particular can with full of sugar. I'm not going to mention the name. And I wanted to be, opening up that the word, that the sound like tss. I wanted to hear that. I brought it, went into my car. I drank it, opened it and drank it. Then only I understood that I wasn't in control. Why did I turn into to the petrol station? Because I know there's a supermarket. So you see, at that point of time, for the period of 7 minutes, I lose control. So at that point of time, it wasn't in my control at all. So to think about it, people going on a certain diet, a crash diet, they are actually setting up themselves to a higher cravings in the next 1 month or 2 months or 3 months, so that we can lose weight. But in the next 3 4 months, they double up or even triple up the weight they put in. So it seems scary. So I think when it comes to diet, I think it's very important to be looking for a dietitian or nutritionist to understand how the body works, what blood type, and then before embarking into a nutrition plan. Will you agree there, doctor?
Absolutely. I mean, I've seen so many people, so many patients with all types of different diet: keto diet, intermittent fasting, carbo diet, Atkins diet, this diet, lot of things. And yes,
Right,
they do lose weight, as you said. But as long as your body, is not that your body doesn't require sugar. Your body requires sugar, but it requires in small amounts. And the idea is to have everything not in huge amounts. And if you can control the volumes right, and if you can have everything together, it really works well. You can still lose weight, I feel. Yeah. Depriving yourself totally of sugar, I think, well, I would also be going to the gas station. Is
doctor,
not
I'm going
easy
to
to
try
do.
next one. I'm
Uh-huh.
going to try the next one on Medu Vade to go away from Medu Vade for 1 month.
Can.
Just
Well,
going to try it
because
out, right?
I think you can try it out. It might work also, but after 1 month, you will have to see what happens after that.
Exactly. Because there's a control over that period, the duration, right?
Yes.
And then
Yeah.
once after that, I feel that, hey, you know what, I reached the target and now I'm allowed to enjoy. So the key question here is about the journey. It is not
Yeah.
just the destination that we're looking at, say, hey, 3 months, I'm dieting and then I'm jumping. No, so it's become like a yo-yo. You gain weight, you lose
Absolutely.
weight, gain weight, lose weight. And then that's
Absolutely.
why all the GI issues comes in, high glycemia, low glycemia, the glycemic
Very
index issues as well.
Very true. So you absolutely nailed it. So the glycemic index going up and down constantly causes more damage to the body in the long run, and to all the hormones which are flowing in your body and your brain signals which they are getting, because it's all mixed. Your brain is doesn't know what you're doing, and it keeps
Exactly.
on cannot understand. So it's like you're disconnected from your own self. You see?
Yeah.
Yeah.
And also, doctor, people are nowadays stressed, they're overeating, depressed, they're eating, happy, they're eating, sad, they're eating. So food has become a comfort. And it becomes like, you know what, I'm going to have that chocolate. Say, why? Oh, I got a stressful day. Oh, I'm going to have that kind of alcohol. Why? Because I had a stress. So, I mean, as technology, as we evolve, things are getting more comfortable, and food are just coming to us from all kind of directions, from love as well as we're ordering. So I think it's a big challenge. So obesity is one of the key issue. I think we all should take seriously. If not, we can be a victim for that, right? And
Really.
obesity also increases a lot of other illnesses, right, doc? I mean, one of the particularly
So,
is
so, so
uh,
that's when I get referrals about obesity, right? I get it from, like, I can get it from a gynecologist because of infertility. I can get a
right,
obesity referral for surgery from an orthopedic surgeon because of knee problems, as you mentioned before, from an ENT surgeon because of sleep apnea and high snoring,
yeah,
from a oncologist, cancer surgeon because patient
right,
has developed cancers because of obesity, and also from a cardiologist because of high blood pressure,
right,
diabetes, and heart problems from overweight. Yeah, so I get
correct,
referrals from all these kinds. So they land up in all clinics, unfortunately. And
right,
the idea is to help them and get them to a place where somebody understands their problem and not victimizes them and not
sure.
judges them for their problem. Yeah.
Thank you, doctor.
So
Thank you for
that's where
that.
we
Now we
come in.
are. Thank you, doctor. So we're jumping into the complication part. I mean, of course, every surgery has its complications. So we would like to know the bariatric surgery and how they can be minimized, or is there any issues that someone should look for?
Yeah, so there are short-term complications and long-term complications. Of course, the short-term complications regarding the technicality of the surgery, whether when you cut something and remove from your body, like your stomach in a sleeve gastrectomy, you usually are worried about a leak or something like that, about your that cut part opening up, and those kind of things. The chances are probably minimal, about less than 1%. But those are the short-term complications we are talking about. Long-term things to manage and complications are, of course, for diet and nutrition, which plays a very big role in patients. And if they don't take care, and if they go on to junk food, then they will be very brittle patients, because now they are eating the wrong food and they are still losing weight. And that is a double whammy. So nutritional complications like deficiencies of vitamin D, B12 are some
Mhm.
things which we are very worried about, and we monitor them very closely for the 1 or 2 years after surgery. Yeah. The other thing is,
Doctor,
of
we're going
course,
to,
sorry,
sorry,
you
doctor,
go
you're
ahead.
saying sorry.
Go ahead. Yeah.
No, because what we're going to compare right now, doc. I mean, after you're going to say something, and after that we complete that. Last 100 years, where our forefathers do not have this issue. Probably they may have, but it wasn't identified with the technology that we have right now. Or probably because the workload is more and they are always stay these, aesthetic, six packs, lean body, they all look like models. But of course, they've been working very hard, laborers. And is that also one of the reasons because we are now very comfortable with elevators, escalators, bars, taxis, cars, bikes, air condition, everything. So is that also the reason the obesity is increasing, like what you mentioned? No?
Okay, so there are two things, and especially after COVID, two things have become very common, and all research articles are talking about this. That along with COVID caused these lockdowns, which caused some as humans, because we are used to moving around, moving and traveling around. So as soon as COVID went off and we went into this session of revenge traveling, right? Now we have gotten into a session of revenge socializing. And all this
Yeah.
socializing is over food and alcohol. And at the same time, these lockdowns put up a restriction of activities. So there's some bit of hangover of sedentary lifestyle habits which we adopted during COVID, which we are still losing as we go on from it. But we can see that that has caused a double whammy in this last 1 year in Singapore itself in obesity. So you're absolutely right. And also I call it the fast food mafia. No, we are surrounded by the fast food mafia. We cannot escape it. Yeah, yeah. So those are some of the
And
things. Those three things. Yeah.
and also it's easy to reach to us just one call away,
But
or other
yeah,
message. I think nowadays it's just messaging, right?
yeah,
Applications, it's making the humans more comfortable. And as we are heading towards that direction, there's a lot of things also we are bringing along towards us, as lack of exercises. We don't want to perspire. We perspire a little bit when we are like, please on the AC. We need
yeah,
to relax a bit. Let's go to a restaurant where there's AC. So we are taking things more for comfortable. And I think the daily activities, like the health promotion board has encouraged so much that per day you need to do 10,000 steps. And they're constantly, a lot of studies have been done, what it will be best for bigger population of our citizens. But like what we said, the obesity is still on rise, and also because of risk factors that is bringing in from inherited from our forefathers, right? So we are going to go into the next one, which is of course the same thing that we are talking about right now. We're talking about the diet, we are talking about the lifestyle changes. So doctor, if someone in the just given a quick example. So someone is 140 kg. He's supposed to be example 90 kg. So he has this 50 kg. So he embarks onto a journey of strict diet and exercises, and he brings down his weight comfortably. But the same profile or different profile, under 50 kg, he need to bring 90, but he can't. Like what we mentioned earlier, right? He does dieting, he's exercising, he just exercise and exercise, exercise. The weight is not going down. The food also start to control and become very depressed because you're not losing weight and you're not seeing results. So eventually you need to see the numbers going down, but the numbers going down. So that can be very terrible for a particular person who's going through this.
yes.
Um, but also high chances of putting stress on the heart, the knees, and also chances of type 2 diabetes is also on the rise.
Yes, absolutely. So, diabetes, I mean, people above BMI of 37, there are 60% chance of having diabetes. You are talking about a very high diabetes rate in Singapore right now. So these kind of individuals are what examples you gave about people who are trying very hard and cannot lose are classically patients or examples of where their basal tone is at a higher level. The basal tone of your body is at a higher level of storage, but a lower tone of expenditure of energy. These people we see very commonly, and these people benefit a lot from surgery because there is no way to get your basal tone down because
Right.
that is how Mother Nature has made you. For these kind of patients, you're absolutely right. They would be suffering a lot quietly, in fact, and being stigmatized by the society that they are fat and they're not doing enough. Yeah,
Very
and
true.
we really
You
want
know
to
the
take these patients and help them.
even as I see these profiles a lot, some people are just a little inferior, not superior at all, inferior to come to gyms, especially to the fitness centers, because they have always been judging, right? Because I see that, this is basically my comments coming out. I do see people, coming to the gym, like a fashion, they are trying tight clothes and simpy clothes and kind of stuff. But on the other hand, this a group of people who coming in genuinely to get the weight down, and to be healthier and fitter, just by doing a lot of stuff. But unfortunately, there's inferior complex as well. But I think when it comes to health, one shouldn't really bother about what other people are saying, and they should just jump into exercising, of course, with the proper guidance and nutrition as well. But also, doctor, I'm going to give a credit to Singapore SG Active. Singapore SG Active has done a phenomenal job because per entry is only 250, $2.50, and you can stay there the whole day in the gym. And nowadays, the gym equipments and the facilities is super. They're really upgraded. It is very user friendly, and there's a lot of floor trainers. to assist, because I do train few of the clients there, and I see these positive changes are happening in the society as well. So you can see all these neighborhood folks are coming down, you know, range from all the way from 40 to 70, 75, and they are keeping themselves fit. So I think where we are heading as a Singapore, as a country, I think we are doing a fantastic job. Getting healthier and fitter, I think that is the key right now to stay away from
Yeah,
all
so
these problems.
yeah, absolutely right. So, in fact, I like some of these gyms which are made 24 hours also helps, because
Yeah,
some of these people who are very scared of being judged, right, for their weight or their looks, right, they can come at odd times of the day or night,
right.
and they do want
Yes.
to do. And so yes, so the SG Active is excellent initiative by the government, and we do see a lot of results. And actually, we are sort of tying with them also with the whole SG Wellness, SG
Yeah,
Active, and it all goes in with diabetes, weight loss, and less stigmatization, basically. Yeah.
that's well,
So,
doctor. Thank you for that.
uh,
Yeah.
yeah.
Okay, Doc, we are going to go into the next one. Also, looking at the recovery processes.
Hmm.
Will there be a lot of pain? Whether they can walk? I mean, these are the few questions that people might have in mind, but
Hmm.
they probably may not have the answers, or they are afraid. Oh, I don't want to go through this. What will happen if I, something happens? So what the patients can look for
Yeah, so
in the recovery
I mean,
process.
I talked a bit about the preparation already, right?
Yeah,
They have to
yeah,
have these psychosocial modifications done by a group
right.
of doctors and paramedicals, including a health coach like yourself. And after those interventions are put in, and we do need to see whether they lose some weight before surgery by those interventions, because that
Right.
makes that's like a almost like a test for them, because they need to have these changes done. They need to change a new leaf. And traditionally, the surgeries were all done with big cuts. But nowadays, we do surgery, keyhole surgery, as we call it. These are small, tiny cuts, about 1 centimeter big on your tummy, and 4 or 5 cuts, and that's it. We finish it off. Is a quite short surgery, a short duration surgery. So, about 2 hours or so, your surgery is done through small keyholes. So, your recovery is phenomenal. Usually, most of my patients would be walking and drinking a bit of water on the day itself in
Mhm.
the evening. And the next
Right.
day would be drinking liquids already. And maximum they would be staying till the second day after surgery in the hospital, where they're optimized, where their activities optimized, where a physiotherapist has seen them. And once they're walking around and no vomiting, and they're tolerating all their liquids, they are ready to go home. Yeah, so most of them go home by the second day after surgery.
Doctor, this happened, I think, a couple of years back. I think, if I can remember, probably it's about 5 years ago. I have a client profile who is 170 kg. So, yes, just to walk about 10 meters to 20 meters, he or she felt a lot of pressure. But over a period of 8 months, we did not see any weight loss happening. Probably maybe 1 2 kg. That's the maximum. But with the kind of food planning and the kind of exercises and walking, the weight didn't went down at all. And he has resorted to bariatric surgery and actually lost huge amount of weight, and also because he was also diagnosed with stage 2 blood pressure, 160 over 100, and he's taking some blood pressure medications as well. So the weight has become an issue. He can't move, he can't get into clothes, you know so I think that was the biggest challenge, and I think now is looking good, because then it becomes a healthy lifestyle. So those who actually go through a bariatric surgery, they should continue what they're supposed to do: eating healthier, going to the gym, exercise, take care of themselves. So it's a lifestyle, right, doc? They can't just say, oh, you know what, I lost 100 kg, I'm going to go,
No,
not going to
no,
exercise.
no.
Yeah.
Is a lifetime of commitment. So that is what we see. So that's why we want them to lose weight before surgery. If they are committed enough, they will lose a little bit with our strict monitoring. And once they show us that, then surgery will surely help them. But as you said, is lifetime of follow up. That means they will need to take some type of supplements. They will need have to have their diet looked on. They can't be going to junk food. They will have to eat nutritious thing, because whatever little goes into your mouth has to be very good. Yeah. And also it has to be followed up, because when you lose, see, about 1 kg a week, if you're losing, right, that is the normal body can take.
Okay.
That is how we are made. Because when you start doing other things by food, by this, you usually lose 1 week 1 kg maximum. So you lose about 4 kgs a month. But after bariatric surgery, right, there will be a drastic, like you will lose 10 kgs in 2 weeks or 10 kgs in
Right.
10 days.
Ah,
So that kind of drastic weight loss, right, needs a lot of support from friends, from doctors, from the patient itself, himself or herself also. And the
right.
support is in all forms: psychosocial, nutritionist,
Psychosocial.
and to make sure you're healthy. Because if you don't keep on doing exercises, once you start losing weight, saying, oh, finish, lost weight already, I'm time to enjoy now, go back to my food, go back to my nasi lemak. You can go back to your nasi lemak, but in small amounts. But you have to exercise
Yeah.
because your muscle will start losing so much of protein, and you'll be deconditioned completely.
Correct.
Yeah. So actually, the story with the patient's commitment starts after surgery. Yeah. That's why I say that,
Right.
this patient of this client of yours, which you're giving an example, is a classic example who tried everything and then now
Yeah.
realizes the value of surgery. So they will never go back to their original lifestyle because
Yeah.
they have seen the worst.
Right.
Yeah. So we
And
have to
also, I
do
think
our due diligence.
the pressure on the knees, especially the whole
Yeah.
weight is taking in, and then it will end up swelling. Then you are inviting a lot of uninvited guests to your own
Yeah.
house. So it's like, stay away, stay away. I need to do certain precautions. Stay away, stay away. Yeah, doc.
That's
So
that's
it's quite
absolutely right. When I operate on my patients, right, I tell them, look, you're going for surgery. You need money for surgery, of course, but save some money up because after 6 months, you're going to need a new wardrobe. And that in
oh yeah,
itself gives them that itself gives them a big, oh, okay, I'm going to go into smaller clothes size. And that gives them this positive motivation, and they continue doing things.
yeah.
Yeah. So those are the things which they look out for, and we want them to help with. Yeah.
Right, and also that boosts up the confidence level, in terms of
Absolutely.
psychologically, physically,
Can you
emotionally.
imagine from an extra large you
Uh,
go to medium size? I
yeah,
can tell you these people are very, very happy people now.
right. And
Very
also,
happy
doc, to
people.
stay away from all these illnesses, I think that is one of the key issue. Stay away, stay away. You push everything away,
So,
and
so, so
you do a positive.
most of the patients will lose, their medicines will go down. And if they are good enough, even for diabetes and blood pressure, they can disappear. You can stop taking
Right,
medicines.
right.
So yes, so it is an amazing effect which they can experience if they are in the right platform with us. Yeah.
So definitely, they need a lot of family and friends support,
No, no,
especially the loved one
absolutely.
support. Huge
I,
amount of it.
yeah. Maybe I just give you a small example. It's like, if you're sitting on
Sure.
the family with your family dinner, right, in the evening,
Yeah,
and this is a patient who has done surgery, right? He will be eating 2 spoons and he'll be saying, I'm not eating anything.
yeah,
And and in some families we have seen this halo effect, as I call it. Because what happens is that now they see this person in the family who has done surgery and is losing weight by eating less, right? It has a positive impact on the rest of the family also. So yeah, this halo effect is also quite good. So yeah, they can also help their friends, and the families can also help them. Yeah, not to stigmatize them. Hey, how come like that?
yeah.
2 spoons already. Come on, finish your plate, lah. Don't waste food. I don't think that works with them.
But also, I think it becomes like a responsibility. Hey, you know what? My so and so have done this surgery, so I want to support. So I don't want to eat unhealthy stuff because that may create cravings for him. So let's order or let's eat healthier together. So you see, the whole thing to start changing, even though it's a one single step. But eventually, you will finish up a marathon.
Yeah,
So I think it is like what you mentioned. It's a very holistic, and at the
dynamic.
same time, the support is
Yeah,
important.
very true. Very true. Yeah.
Okay, doc. I mean, we have covered this. We covered about this role of
Yes.
exercises and physical activity. I mean, these are the few things that they have to go through before they, get into a serious consultation and see, hey, if I don't do this, what will happen? Or if I prolong this, what may happen? So all the possibilities. But of course, in the success of a bariatric surgery, eventually, and of course, it's not just for aesthetic purposes, but it's mainly for the health reasons and to stay away from a lot of other illnesses. They may come in uninvited. So they're not the invited guests, all these uninvited guests. We want to push them away. So that we have already covered. But I'm going to take one question. that has been asked by one of the viewers who are not able to. Okay, so she's asking about the discipline as well. She said, what's the percentage of clients who are not able to sustain the discipline after the surgery? So we may not have the percentage, but maybe we can jump into the discipline that what we talk about, doctor. I mean, out of 10, if let's say I'm a foodie, will I be able to control the medu vade? Instead of 10, maybe I take one. I'm still bringing the vade, but
Yeah.
on a serious note, is there possibility that, doc, we are looking at this?
Yeah. So we do have failures, and there are people who cannot maintain the discipline, and we do see them, and we usually see them at about 3 or 4 years after surgery, when they have lost all the weight, they have forgotten all the bitter lessons they had learned, and they tend to become a bit naughty. And is best to, if they can come back to us, we can get them back on the stage. I mean, if the surgery is still intact, then usually the help of a dietitian and a psychologist, we can get them back to track, and also with like a fitness expert or someone like that, we can get them back into the track. Rarely there are other reasons why they put on weight, just not discipline. And it's very multifactorial, because obesity itself is very multifactorial. Why they lose their discipline can be many things. As you said before, also we discussed stress, death in the family, um, things, moving countries or moving places, right? It can be many multi factors why people lose discipline. Yeah, but we are there to help, but sometimes they shy away from help, thinking that, oh, he'll tell me only to do this only. So that is the kind where we say, no, please come over. There are many things. It keeps on improving. We have more things to offer. Something might work for you, and why not? Yeah, I hope that
Thank you,
answers the
doctor.
question. Yeah.
Thank you, Mala, for the question that you posted. Thank you so much. All right, Doc, we are almost at 47 minutes of our conversation, and I know we have covered a
Okay, I
lot.
didn't
Viewers
realize that so fast. Okay, okay.
Viewers are encouraged to ask us questions. We can engage Dr. Kaushal on this topic of approaching bariatric surgery. Dr. Kaushal is a specialist in general surgery and consultant, Raffles Surgery Center. So while more questions are coming up, Doc,
Hmm.
I'm just going to
Go
jump
ahead.
into what I've actually noticed when I visited your hospital. So I was this at this Raffles robotic surgery. I was like, whoa, is there like robots going to come out? But what is? But of course, wasn't an opportunity to go inside. But what exactly is happening inside the operating theater, doc? I mean, if you can share
So,
something, is there like robots
sure,
coming
sure.
in? Yeah,
Yeah, so people understand robotic surgery as shown by Hollywood movies, where there is a independent robot which sort of works on your body, which is programmed to do a certain surgery on you, but is nothing like that yet. The robot is very well controlled by the surgeon. It is just that it gives you this steadiness in your hands and your movements, which
yeah,
makes surgery much more easier and better. So yes, so the robot is there. In that sense, it is a robot. It is a programmed machine which does the surgery on you, but it's like
right,
surgeons are controlling it completely. Yeah.
right,
So it is
right.
not. It is not on its own. Yeah. There's no.
Okay.
It's not AI powered where it is working on its own. Oh, I just put appendix and it does the operation. No, some nothing like that. Yeah.
Right. But doctor, on a serious note, in a 50 years time, probably not even 50, maybe, I don't know, I'm just throwing a number and you are, listening to it. Maybe about 20 years or even 15 years. Will there be a place called Dr. Vance, the robots come, yes, this is the patient. Will there be what we be seeing in the next whatever good years that's going to come? Robots taking over?
I, I, I think surgery still requires some amount of human touch, experience, and judgment till the time we can make such advanced robot. Yeah. So this is a very important question, and I did ask someone like this, who is my professor, who's my teacher, and I asked him. He said, "If you operate like a robot, you will be replaced by a robot. So operate like a human, operate like a good surgeon, then you can't be replaced by a robot." But
Right.
nevertheless, if you have such advanced robots in the future, who knows? Who knows? We are always open to new technology, and we do keep up on track with all the new things which are coming. But the
Right.
fact is that there has to be a certain amount of human touch still. I mean, that's the era we are in. But 10 years, 20 years down the line, yeah,
Right.
I
Thank you,
do
doctor.
not
Thank
know.
you.
Yeah.
And I know, doc, I know you mentioned to me, each surgery can last about 4 hours or lesser than that.
About 2 to 3 hours. Yeah,
2 to 3 hours. Okay.
yeah, yeah.
Wow. Okay. And the longest hours, doctor, I mean, you ever performed? I mean, I know,
I mean, we
like
we,
six
we do
hours.
sometimes, yeah. So we do sometimes do redo surgeries also. That means patients going for one weight loss operation, and then after a few years they come back again, and we do a second operation on them for weight loss. Those kind of surgeries are more complex and they are more challenging, and those would take 4 5 hours to do. Yeah, surely. Yeah.
Wow. All right, Mala, thank you for that question as well. She said that yes, it requires a lot of psychology. I know a lot of psychology, doc. I mean, even when it comes to food control or even come to exercise, I always tell this to my trainees. Excuses are plenty to give, right? Rain, cat run over by rat, bicycle got punctured, the weather is cold, the sun is hot, the gym is far, I'm feeling tired. Excuses we can keep on going on, but I think the discipline within you makes it the results to come by in the next 6 months or 8 months to along the journey. So I think it's very important that once we decide, maybe we set ourselves, say, what, in every week I want to do 2 hours of activity, and I stay very religious to it. I stay very strict to it, and I make sure I conquer it. But when you start giving excuses, I think that's where you become too comfortable, and then less inactivity, and then we are inviting a lot of problems nowadays because we are always in this comfort zone, doc, right? Like what we mentioned, doc. I think you mentioned a very strong point as well, because obesity is just not just overweight and looking big, sorry to use the word fat, but it is more than inviting problems, because if your weight is certain, then I think your body is not active, and a lot of other illnesses are coming by. So I think it's very important to keep your body healthy and fit. Yeah, there's someone to look like handsome, sexy. I want to have six packs, I want to become muscle. That is of course aesthetic, but I think overall fitness is the biggest health you can ever get. So you have to bring your health and fitness together. So I think that's what I
Absolutely.
like to say.
I cannot echo it enough more. But yeah.
Thank you,
So
doctor. So yes, 52 minutes into it. Doctor, before we end the conversation, I know it's been a long day for you because we had a prior chat. So I don't want to take more time of yours. But if you want to
no problem.
give a tip to the audiences who are listening, what it may be.
Okay, so I would like to echo and sort of emphasize a few things we discussed today. One is that obesity begets obesity, and the patient gets trapped in a vicious cycle. So, to realize that you are trapped is the first step to your health and good health. So, patients should be aware that this is a trap there. Do not be judged or do not get angry if people judge you. Realize the trap you are in and come out. Secondly, I just want to re-emphasize is that obesity surgery is not a cop out. It is not, I don't have a magic wand. You have to change lifestyle. You have to eat differently. You have to exercise differently for it to work. Okay. So it is all in all a holistic care along with surgery where all these things are there. So these are the two things I would really emphasize to patients coming or thinking about bariatric surgery. And there are just not surgery. We offer a lot of things. We offer balloons, we offer medications to help you to lose weight. So come to us, and there are a lot of options. Just because I you see me doesn't mean going for surgery straight. Yeah. So be aware of your options, and that's what we want to help you with. Yeah.
Thank you, doctor. Thank you so much for that humble advice that you have given. I mean, I think it was just 2 days back when I was at Raffles Hospital. I was quite amazed. The facilities is so, what shall I say, so just amazing, right? And
Yeah.
when I reached to your level, I think I was like, wow. So I was just thinking there may be robots walking by, but unfortunately, I didn't see any robots. But yeah, so special thanks to Raffles Medical Hospital as well for to support these podcasts, and also to have an expert guest speaker to join me in
Yeah.
Kopi event. So thank you so much, doctor.
Yeah. Thank you,
And
Vance. Thanks a lot for having me on this forum. Thank you very much.
then I promise I will not go more than two medu a day. I will just keep it to one.
Okay. Okay. I'll try to keep it at half. Yeah.
We shall take this offline, so we shall talk
Yeah.
about whether one or two
Okay.
medu a day. All right, doctor. See
Okay.
you then. Thank you so
Okay.
much.
See you.
Have
Bye
a
bye.
pleasant
Good night.
day.
Good night to everybody else there. Thank you very much for watching. Thank you. Bye bye.
All right, so here comes the last segment, which is the last few minutes before we end our show. A special thanks to Raffles Medical Hospital who have supported Kopi events. I went a visit to their hospital just about 2 days back, and it was amazing, right? The kind of facilities that we have it in Singapore with by Raffles Medical Hospital. I think it's amazing. And of course, I didn't have the opportunity to go inside the operating theaters, which I think is very sensitive, which I didn't. But overall, I think it's very nice. Of course, the atmosphere is good, and everybody was just polite, and the whole environment is such a great pleasure to be there. But of course, as much as possible, stay away, stay away from all these illnesses. I think that is the most key point that we are trying to make here. So yesterday we talked about approaching bariatric surgery, and our special guest speaker from Raffles Medical Hospital, Dr. Kaushal, specialist in general surgery and consultant, Raffles Surgery Center. So just not just about weight loss, but I think it's more about obesity, and which a lot of things that can affect you over the months, over the years. So it doesn't just comes in just immediately, right? Weight loss is something like a journey, which I think that's what I've been doing it for the past 25 years. It has to be a psychologically, active. Physically, you must be also active in emotionally as well. But nowadays, a lot of people, or I got to say that a lot of us are always giving into emotional. Oh, I'm tired. The excuses are just plenty. I think I've heard tons of excuses. Probably you also may have heard that kind of excuses. I know, hey, you're just lazy. So put all these aside and start be serious about yourself. I think the growth or the body or the temple, the house that you live in is this. So if you don't take care of your house, nobody is going to take care for you. All right. But then it's been too late for a lot of complications and illnesses nowadays are just popping by. And if you look at the papers, all right, we see a lot of issues coming up like atherosclerosis, right? Myocardial infarction, diabetes is on the rise. Everybody is chasing upwards to see who they are. So we need to be very cautious about health. Health is the biggest wealth that we have, or I think the only thing that we can't buy, even though we can achieve or try to do a lot of stuff. But if you're not taking care, nothing is going to come towards you. So I'm going to sign off. And once again, thanks to Raffles Medical Hospital and thanks to Dr. Kaushal, specialist in general surgery and consultant, Raffles Surgery Center. Thanks so much for everyone, for spending this 1 hour of time. So I'm your Vance. I'm going to sign off and I'm going to catch you again on the next episode, which is going to happen Wednesday, 9 p.m. on a different topic. For now, adios, amigos.